All right. It's 7:05, and so we're going to start. Thank you so much again for joining us. We're going to start off today's session with the idea of highlighting key concepts in diversity, equity, inclusion. And really, this is geared for as a primer for leaders in academic emergency medicine. We know that each of you are interested in doing some leadership work, and we're so grateful for that because it's people like you who's going to make a significant change on how representation will be a lot better in our organization. Again, I do want to thank the people in this group right now, and so I'm just going to ask them to introduce themselves. Again, my name is L.A. Alvarez. I'm one of the Associate PD at Stanford.
I'm Emily Binstead. I'm Director of Simulation and on our task force for diversity, equity, and inclusion at Regents Hospital, and we're affiliated with the University of Minnesota.
Hi, everyone. I'm Ashley Deutsch. I am the Director of Quality and Patient Safety and soon to be an Associate Program Director at Bay State Medical Center, which is affiliated with University of Massachusetts Medical School.
Congrats. Wendy?
Hey everybody, I'm Wendy. I'm one of the second-year residents at Yale New Haven Health. Really excited to become a third year. Super excited to be part of the team and excited to be here.
And president of RAMS.
Thanks for the
Speaking of RAMS, yeah, we're really grateful for the sponsorship of ADIEM and RAMS for this talk. And so the very first thing that we want to do is to start us off with some bit of engagements. There's a few of you in the audience, and so we want to make sure that we can get to know you better. And so let's go to the Jamboard. If I do this right up, you'll see my Twitter. You will see that we've created this Jamboard so that we can have some interaction. Many of these things in the chat later on will not be saved really for us, and so our goal is to get you engaged. Just a quick primer. Jamboard is really very easy. It's using Google, and it's just about, think of it as just a bunch of Post-it notes. And so I'm going to ask you to move to the second slide to type in and enter your name and then your university where you're coming from. And it doesn't have to be pretty. If there's some typo, don't worry about it. The whole goal is to just try to see if you can engage in the group. Brad, welcome from University of Kansas. Peter, thank you again for moderating us. Indiana, I love this. Robert, I love it. California North State, yay. Oh, somebody took over Peter. Start your own Post-it. This is good. This is exactly why we're doing it, so we can play around with it. Ooh, I love how people's names sometimes shows up as well, and some people are still trying to figure out what we can do. So if you hover on this left side here, this is the sticky note, and then this is the text. So either of those work. So that would be how I would do it. And I usually just move things around. There you go. All right. So the whole goal of this is to just get you started to get a feel of Jamboard. So really, let's get to what we need to talk about. I cannot emphasize the importance of psychological safety, especially when we are discussing topics on equity and justice. We will agree on some topics, and we will also disagree on several of them. And so I ask that you come in with a beginner's mind. Continuing with these sets of ground rules, I'm also starting this talk with the assumptions that this is a safe space for everyone, and that we're here to foster inclusion in a sense of community. You're all leaders in SAEM, and we're very excited to work with you. Again, I ask that each of you respect each other as we learn more about key concepts on diversity, equity, and inclusion. We admit that we may have feelings to profess ourselves as experts, but we're fallible. We may not have all the answers. And so we're here to learn from you as well. And that's why we're doing these things like Jamboard and the discussions to hopefully learn from each other. And so with that, I acknowledge the difficulty of many of the topics that we'll cover. I acknowledge as well that some of them will potentially bring up strong emotions. And so I ask that each of us will commit to a good faith participation, for ourselves and others, and again, having that beginner's mind. This workshop is meant to be as interactive as possible, and so I encourage you to participate as you feel comfortable. We also encourage you to turn on your camera. We don't care if you're wearing your pajamas. That's the reality of this. And honestly, this is the last day of SAEM. Feel free to grab your coffee and join us. And so why don't we talk about like what diversity means to you? Because diversity can mean different things to different people. And so it's important to for us to define that. I love it. People are typing in the Jamboard now. Maybe we can use this to type in like what diversity means to you. Or if it makes it easy for you, we can do Chatterfall. Just using the regular chat. In the next minutes, don't hit enter yet. Just type in what diversity means to you. We'll wait. And then when I say click enter, everybody will just enter your idea of diversity, and then we'll see people's definition. I love it. People are thinking. I see the faces. Some people are typing. All right. 5, 4, 3, 2, 1. Embracing uniqueness, variety of people, improve creativity, collegiality, many voices, many backgrounds. I love it. This is great. Opposite of sameness. So just read around and see even the diversity of our definition of diversity. And so we're going to add a couple more words. Justice has to do with dismantling barriers to resources and opportunities in society so that all individuals and communities can live a full and dignified life. Equity refers to allocating resources to ensure that everyone has access to the same opportunities. And equity recognizes the advantages and barriers, the isms that exist. And so we talked about diversity, all the differences between us, based on which we experience advantages or encounter barriers to opportunities. Diversity just isn't about racial differences. And lastly, and also importantly, inclusion, fostering a sense of belonging by centering, valuing, and amplifying the voices, perspectives, and styles of those who experience more barriers based on their identities. And some people might have seen JEDI as the new acronym instead of DEI or EDI. So yeah, so feel free to use that as well. So here are the plan for the remaining of the session. We have created some scenarios that we'll be discussing as a group. So for each of these scenarios, let's put on a couple of hats. One perspective will be that of an individual. So put yourself in a perspective of the individual. How would you address these topics from an individual position? And the second hat that you'll put yourself in is that of the leader. As a leader, what solutions do you suggest and how we can address many of these topics on diversity, equity, inclusion? And so let's start with Dr. Ashley Deutsch.
Thanks, everybody, and thanks again for having me. I used this picture to talk about starting the conversation. This is myself and my husband, and then that is my daughter. And those of you who have children might know that when you're traveling and your kid says they have to go to the bathroom, what they mean is they will go to the bathroom in about 2 minutes. And so that's the amount of time you have to set up some kind of situation. And this is what happened for us. And as you can imagine, right, as a large group of people walked by, that felt very awkward. Right. That is they were feeling awkward. I was feeling awkward. And that to me just represents what oftentimes starting this conversation can be. If you don't mind advancing, Dr. Alvarez, next slide.
Yeah, of course.
Thank you. So first of all, when we're talking about this, there's a lot of terminology, and we just wanted to pull out in the best way we can represent. We use minority, we use marginalized. People can be a minority and not marginalized. It is a sort of specific terminology, and the terminology and preferred terminology often changes. And so in having these conversations, you're going to acknowledge you're sort of doing the best you can to have these. But when we talk about marginalized people, we're often talking about people with disabilities or people who have mental illness, or people who may have be non-binary or female or not male and white. And so we'll use some of these terms a little bit differently. Next slide. So the first thing, if you're looking to have this conversation as a leader, and I'm really thinking about this as a leader within your emergency group. Number one is to acknowledge that this is an awkward conversation. This may be awkward for everyone, and that sometimes this can feel like a maze of landmines, and that everyone is trying their best not to step on a landmine or insult someone. And just as Dr. Alvarez said, the main thing is to create a safe space for this conversation, to have a space where you say, listen, we all realize sometimes we're going to say the wrong thing, but we're going to acknowledge that the intent behind this conversation is good. And we all have good intent in increasing the diversity and equity within our group. And so this is a space where this conversation isn't going to leave this group. We're not going to say, hey, did you hear what so-and-so said? This is a learning safe space. We're also going to make sure that we talk about how we are going to correct mistakes. So we're going to acknowledge we're going to make mistakes, and then we're going to say, all right, how are we going to correct them when we make them? We're going to have an open conversation about what that remedy might look like. And finally, I just want a sort of precaution for leaders that you want to be aware of asking people to do free work just because they represent a minority or disadvantaged group. So it is great to solicit opinions and experiences from other people who have experienced something you haven't, but you also should acknowledge that when you're doing that, you're asking them to do work and recognize it in some way, whether that's with protected time or a title or some sort of leadership opportunity. However your department can do that, you need to recognize that you should compensate people for the time they're putting into this. It is not their duty as a marginalized minority person. Next. All right, so where to start? The easiest place I think to start is to look at what is the makeup of your group overall. Where are there opportunities to diversify, and where are you doing really well at this? And part of that allows you to use data to divorce this conversation from an emotional aspect. So you are truly trying to figure out the data within your group and say, where could we do a little bit better, and look at it that way. Next. Thank you. So consider starting somewhere that your group considers easy to evaluate, fairly easy to fix, and that's generally agreed upon. I'll tell you, some of the groups that have started this have acknowledged, okay, we think that our female or non-binary faculty members should be compensated the same way that our male colleagues are compensated. And so that's a nice, easy spot for those departments to say, let's look at salary and protected time and leadership titles and time in between our female and non-binary members and our male members. And everyone, it's a little bit hard at this day and age to argue against that sort of equity. And so you get the department on board and looking at how to do this, how to have this conversation, how to use the data. You should build a group that's interested in promoting diversity and equity. So looking within your group and asking for sort of a smaller core group to start this work. And also so that you as a leader are not the only person doing this. You want to consistently ask for anonymous feedback regarding things like inclusion, micro and macroaggressions. And when you're asking for this feedback, you need to have a way to address it so that it's not just sort of going into the void. And so I think the two keys there are consistency and anonymized feedback. You're always going to ask for it so that people have an opportunity at regular intervals to discuss the microaggressions or macroaggressions they're experiencing that they may not feel comfortable bringing to a department chair or someone like that right away. And then you want to make sure that it's anonymous and that you're acting on it. And then really just asking, does your faculty reflect your patient population is another way to look at this. And if they don't reflect your patient population, why? And how could you improve that? We know that representation makes people feel safe. So when we're talking about kinds of diversity or equity or inclusion that you may be looking at, there's a lot of places to start. And these are just some that sort of came to the top of my head, right? We often think about race and ethnicity, but or gender, we may also think about academic rank and promotional status. Are people getting promoted in a way that is equitable? What about a diversity of economic backgrounds? What about geographic backgrounds? Everybody adds a little different perspective. We talked about salary equity. How about sexual orientation? There are so many places you can start within your faculty to just pick one and use data and start building your group that's interested in having this conversation. Next. So this is SAEM. We want to talk about data and what's out there. And one of the things we're going to talk about is the snowball effect. And what the snowball effect really means is that diversity begets more diversity. The more diversity you have, the more diversity you will recruit. And so oftentimes there is sort of a jumping off point where if you get over the hurdle of recruiting more diverse faculty, then you, in fact, that ask gets less and less because it becomes easier and easier because people see themselves represented. And so we saw this, sorry, next slide, in something published by Highland Emergency Medicine called the Diversity Snowball Effect. It was published in 2019. And what they noted was a disparity between the general racial and ethnic makeup of the US population and their residency. And so they said, well, how can we increase the diversity of our residency? And they did basically three things. They took away their USMLE score filter. They acknowledged that it didn't really project how well someone was going to do in residency, and that there are many barriers and inequities in getting to the point where, you know, the USMLE score may be a little bit higher. And so they just did away with it. They said this isn't an equitable evaluation of medical students. They increased the weight for the interviewer's Gestalt score. So is this person going to fit? How do I feel about this person within this residency, and are they going to do well? So they increased their weight for that. And then they put together a specific diversity committee, which we had talked about a little bit earlier, and also actually a whole applicant week that was aimed at recruiting more diverse individuals. And they were able to increase their underrepresented minority residents, their proportion, from 12% to 27% by doing these three things, which is pretty remarkable and much closer to sort of the makeup of the general US population. And then again, they found with the snowball effect that things were getting easier and easier to keep that recruitment going. So finally, I'll just say that transparency here is key. Transparency among your faculty. This is our data. This is what we are going to look at to do recruiting, and soliciting feedback. How can we do this in a way that everyone feels is equitable for themselves? All right. And finally, we just wanted to open up a little bit to a conversation about how people here, whether you want to unmute yourself or put it in the chat, have you been having these conversations? Have there been hurdles, difficulties that you've encountered in starting these conversations, these awkward conversations, and have you had successes?
Thank you so much, Dr. Deutsch, for giving us such a wonderful overview of having these difficult conversations. So the next part, I think, what better way to put things in practice than actually to start the conversation here in a very safe environment. And so let's hop on to Jamboard, where we'll talk about our next scenarios. So the scenarios I'll be, starting the conversation about is on the imposter syndrome and gratitude tax. And so the scenario that you see on the orange Post-it note is on the gratitude tax, which most of the time people who are underrepresented in medicine might feel that they kind of have this sense of gratefulness and gratitude towards their organization. So don't really, tend to feel so indebted to their organization that they stop, looking for further careers, and because they don't, they feel like they have to keep on giving back to their organization. So, from this scenario, let's kind of think about if you've had colleagues that experience this, or if you yourself have experienced this, and how you would navigate the situation. And so the scenario on the left is an underrepresented minority faculty member learns of a new job opportunity at another academic center. On telling the chair explains how valuable this particular faculty member is at the current academic institution. So just curious out there, how would you, how would you navigate the situation if you were the underrepresented minority faculty member? Or if you feel more comfortable being, coming in from the perspective of the leader in the scenario, what would you do differently? Feel free, to unmute yourself, type in our chat.
I'm not doing so good with Jamboard, so I'm gonna talk if that's okay. I think
love
it'd be
it.
important. I think it'd be important for the leader to understand why that person is even looking at another opportunity. What is it about kind of the current place where that person isn't achieving what they want to achieve, or feeling appreciated, etc. I think it's a further conversation with a lot of listening.
I think that's a great point. There's also the question of how can we match the offer? What title, role, or play will keep you here? Any other ideas? This is great. We're practicing medical education here, so we're waiting 7 seconds before we say anything else.
The first thing that came up when I read your scenario, the chair explains how valuable this faculty member is. The first thing that popped into my head was put your money where your mouth is. Are you showing that? Are you showing?
Dr. Carroll, I think you bring up such important points. Like, that was one of the things I really wanted to highlight in this scenario, because a lot of times, especially, underrepresented minority medical students, residents, and faculty members, really do encounter something called the minority tax, where just because by belonging in that minoritized group is, tasked with the responsibility and often not compensated to, fulfill those roles. And so I think, thank you so much for sharing all of that. I was curious, do you have any other thoughts, or if anyone else in the audience member has it? I guess, if we were in the shoes of this faculty member, how could we approach the situation? I know it's kind of daunting, talking to the chair about what you want your next steps are, because you don't want to burn bridges. And so how could we maybe start this conversation?
I like that question, Wendy. And it seems like you're referring to the idea of imposter syndrome. And I know that some people don't believe in imposter syndrome because it's really the results of the environment, right? So there's the biases and the microaggressions, the minority tax that's Dr. Binstead is going to be covering next. Like, all of these things can affect somebody's beliefs on themselves, their ability to even perform, because they may think that they don't belong there. And so how can, as a leader, how do you deal with somebody else's imposter syndrome to encourage them to stay in your organization?
I think that's a great question, but I would also just throw out the counter question of also, should you be encouraging them to stay in your institution? Because I think that's the other part, right? Like, perhaps as a chair, you should be the advocate or the sponsor that says, you have unlimited potential. Let's look at this together, not as your chair. Let me step aside from that role and be your sponsor, your advocate, your ally, whatever. I think the bigger question is, it's great if someone comes to you and asks, about that. it's all those other people that aren't even asking because they've decided that they do have imposter syndrome or whatever, or even just the gratitude text that's propelling them to say, I'm stuck here because people have been so nice to me. I'm not even going to look. My blinders are on. This is where I'm headed for the rest of my career. Like, it's one thing if someone comes to you and asks, right? But so many people probably aren't even asking. So as a chair, I think that's even the bigger, or a leader in general, in trying to improve diversity and basically just improve the career trajectory of people that
Yeah.
are you're in, in contact with, is how to bridge that gap.
I love that you brought that up, Dr. Binstat, because honestly, like you were saying, sometimes, people who are affected by the minority tax might not even realize that they deserve to, look elsewhere to see, what is best for their careers and continue the impact that they're making. So I really love how you brought up that it's important as, a leader in the department to also look at the growth and development of your faculty members and see if there are ways to sponsor. So I love that you brought that up. Thank you.
It also actually brings up the question that Dr. Deutsch brought up earlier, like how do you start these conversations? Because these can be very challenging, right? Like it can be uncomfortable. Anybody in the crowd?
I feel like this is all about the relationships that you have with each other in the department. I feel like hopefully as a chair, as a leader in the department, if you have an ongoing, sort of longitudinal, open, supportive relationship, it takes away some of the, some of the stress of these conversations. Because I feel like that's the key is starting people people trust one another and they believe that each other, have each other backs and that we're all, going to promote one another. I think that makes such a difference rather than just sort of waiting and all of a sudden dropping into a potentially difficult conversation. You really can bring down the heat of these conversations just with ongoing active work on relationships.
I think that's a very, very important point, right? And often I think we even struggle with starting that conversation. And so what I'm hearing, so even Nicole suggested like having an ally that you can talk to, or having a mentor that will kind of guide you. So as part of the infrastructure in that in your department, creating different points of contacts for people to feel comfortable, as Dr. Lavelle pointed out, so that you can freely talk about your strengths, your weaknesses, before you even like bring up the idea of like, ooh, there's another cool opportunity. Should I even apply for that? Am I even good enough to do that? And hearing a lot of these affirmations from your colleagues, from your mentor, the sponsors in your department is very, very helpful. And somebody typed in as well, both sides can focus on what is best for the individual. What are the person interested in? How can they better support potentially in the initial institution? Again, a lot of the idea is hovering about around the concept of support. Any other thoughts?
I think I saw in another session earlier this week that sometimes discussing these topics with someone who is not as exposed or familiar with diversity concepts, sometimes meeting them where they're at can be an effective starting point, because maybe some people aren't prepared to discuss as heavily or as invested at the time, but over time you can sort of work towards that goal.
I love that.
Yeah.
Wendy, go ahead. I know we're like clapping.
I love that, Robert, because I think, what you bring up is so important, that everyone's, at a different place and at a different comfort level and discussing these important topics. And so, as leaders, all of us in the department, that's why it's important to bring up these concepts so that people, even start to begin thinking about it, talking about it, because it's hard to recognize something unless you're aware that these biases and these taxes exist out there. So I love that you brought this up. And I know Dr. Binstat actually have a couple of other scenarios that we would love to talk about and discuss. So I'm going to turn the floor over to her now.
All right. Well, I think that oops, I have the wrong thing pulled up. 1 second. So I think that our next transition is into a discussion of a scenario about minority tax. And certainly there's overlap in what we just spoke about. So feel free to continue the conversation from that into this discussion as well. But I'm just going to read you a scenario and then ask a few questions, both from the perspective of the person that we're going to describe and also the leaders in the scenario. So Michaela Jones graduated 2 years ago in an emergency residency program where she was one of only 2 Black residents during her 3 years of training. Dr. Jones won a medical student teaching award and volunteered to care for underserved populations during residency. She was asked to be involved in the recruitment of applicants of color during residency and saw this as an important service to her program. But her main residency focus was becoming an excellent physician, and her evaluations were glowing at graduation. She was actively recruited by the department chair to join the core residency teaching faculty, based primarily at the Urban Teaching Hospital. There are no other Black faculty members. So in that scenario, what issues regarding the minority tax should Dr. Jones consider? First of all, so feel free to unmute and answer these questions or stick them in the chat or Jamboard, anything you'd like. So what issues should she consider? And then as a good friend or professional ally of Dr. Jones, what personal experiences would you share in advising her whether to take this job?
Ooh, controversial.
So I have not enough screen space here for all of this stuff to stay open.
I'm just going to unmute to answer because I think it's
Yeah.
Love
But
it.
I think that one of the big things is, does she have support that she needs, especially at this, I mean, in residency, it sounds like there was only one other person of color in her program. And then now she's taking on this faculty job. So does she feel that she has mentorship or support she needs? And I think that's almost an easy way to say it. Just ask. And not just ask because of who she is, but maybe that's something we need to ask if you're a leader or a chair, when you meet with every faculty member, ask them that simple question: do you feel you have the support and mentorship that you need or that you would want in your career at this point? And that's just an easy transition if you're uncomfortable with these conversations, to then either be an ally or advocate to question if you should be maybe considering other jobs at other institutions or looking for that type of mentorship or support maybe outside of your own department, like through GME or in other ways. That's something we've done in our department that I think was pretty successful.
I love that. That's such a welcoming and probably self-learning experience. If people were to ask that question to every single applicant for every job or promotion, I'm stealing that, Jordana. That's awesome. I'm gonna tell my chair we should make it happen.
Yeah.
Any other ideas? That's great.
Maybe like to build on that, another thing is that if you have unlimited resources, creating an opportunity such that mentorship is just part of the culture. So it's actually like a paid role in the department so that every single one is tied into another, like you have a mentee, you have a mentor, and creating that space that, again, it just normalizes, like here at our department, when you start, just know you're going to be assigned a mentor. And you don't even have to have that awkward conversation like, do you have a mentor? Would you like a mentor? Like, you're just assigned one. And it's more of an opt-out thing as you try to figure out like which one, because not all mentorship will kind of mash initially, but at least give you an opportunity to like try out like the idea of mentorship.
So any other thoughts on, if you're an ally or you're considering this situation from afar, maybe you're not the individual who's stepping into this scenario, but you're a colleague. What could you do to help this person or help create a welcoming environment if she does choose to stay? So maybe I'll let this one sit and I'll go ahead and progress to the next part of this scenario, and we can kind of talk a little bit more. So we'll add now, the department chair recognizes that the department's faculty has a diversity problem and does not reflect racial distribution of the patients they serve. White men disproportionately hold leadership positions in the department and the residency. The chair has been tasked by a hospital leadership to identify and deliver specific changes to promote institutional diversity, equity, and inclusion goals for women and underrepresented minorities. Hiring Dr. Jones would be a huge win in this category and an obvious deliverable to present to hospital leadership. All new hires have been required to have fellowship training or an advanced degree outside of medicine for this position in the last 5 years. But making this exception would clearly be good for the department, and Dr. Jones has an excellent track record of clinical performance. So the questions are, is it fair to change the rules to recruit Dr. Jones? Why or why not? And does anyone else need to be involved in making this decision? Do you need faculty buy-in for this hiring decision? And what other concessions or offers might be reasonable and fair to consider in recruiting Dr. Jones? So a whole lot of questions. Throw anything out there that you have thoughts on that. I mean, basically, this is talking about the issue where we were, the minority tax comes into play when there aren't enough diversity. There isn't enough diversity existing already in the department, right? That's where things end up getting all shoved on one person. But the reality is the process of changing that is not an easy road. So all of these thorny discussions come to play.
And the reality is that, go ahead, Dr.
No,
Caroline.
I'm so sorry. I was going to say if I was her friend, I would be sitting down with her and, kind of talking through her fears and concerns. One being, is this a token effort? And if there's any bit of tokenism, then she's very much alone. And true kind of diversity and transformation can't just be something that's kind of reported off to leadership, but is an ongoing process, right? So the buy-in is really the support that surrounds her. And if she didn't perceive that, or didn't get promised that, or it didn't come away from, say, a job interview with that sense, then she's being set up for failure.
Yeah, 100%. I would also echo, because this talk is about key concepts in DEI. Dr. Carroll brought up tokenism, and oftentimes, as we're talking about leaders and how we can improve diversity, equity, inclusion, it's usually a reflex for, we're not as diverse, let's be more diverse. But oftentimes that revolves around simply just increasing numbers. And that is just purely tokenism. And so when you increase just numbers, people will still not feel that they belong in that group for various reasons that we mentioned. So microaggressions, the biases, and also the minority tax, because that person, that token person, is going to be expected, or at least inherently they would feel expected to do many more work to increase diversity. That's, I think, the conundrum here, because as somebody who's a minority, there's always this feeling like, yeah, definitely, let's bring more people in, but bringing that people in without support is a lot of work. It's a lot of work for that faculty, and requires them to also sacrifice focusing on areas that they really are supposed to be experts in. And yet now they're going to spending most of their hours mentoring other people, doing a lot of these like DEI events. And again, like, they're doing it out of the goodness of their heart because they truly believe in this mission. And unfortunately, it's taking them away from also pursuing the areas that they should be an expert in. That's a great point. So sorry, go ahead.
No, I think you bring up an important point, right? I mean, is it goodness of heart, or is this a deliverable as part of the job? I would make the argument that if a chair wants to bring this person in, the chair needs to say, you're going to have 20% salary support, your shift load's going to be reduced, you're going to have these other things, and then you're going to have linkages into the institution where there'll be a community of others like you from other departments or at the institutional level. I mean, if you do one-offs, it's never going to work, and we've proven it's not going to work for the last 20 years.
Manish, I love that comment. And I think it's so important to just state that explicitly, because sometimes we sort of just say, like you're saying, it's like goodness and mission and all this stuff, which is true and so important, and nothing works if that's not there. But also sometimes just being explicit and saying, this is a departmental goal and I'm willing to pay for it, and I'm going to reduce your salary and I'm going to do whatever else, is totally reasonable. And someone also said in the chat that the whole faculty needs to be on board if specific, accommodations are being made or whatever. Specifically, I think in this scenario, it would be like the fellowship exception or whatever. But, being comfortable as a chair saying, advocating for that. Like, I think this is a reasonable exception to make because we need this, and this is a value and a mission of our department is okay and great, and okay to be explicit about, I guess is what I'm trying to say.
Well, and I'll use the example, right? Who would be a residency director out of the goodness of their heart?
Right.
I mean, that's not even a discussion point. That wasn't a discussion point when I was a med student 25 years ago. So if no one would ever say, I'll be a residency director out of the goodness of my heart, then you're not going to be these other roles out of the goodness of your heart and do it well.
I love this conversation. I really want to echo what Dr. Lavelle put in the chat, which is it just sets you up for failure if rules are changed for an individual. And so the faculty has to be aware, when they're aware, they become resentful. So it may be okay if the entire faculty is on board, but that's often not the case. And really, that's what Dr. Deutsch was pointing out earlier. We have to have these conversations earlier on. And so when you're saying like, hey, we are hiring XYZ for this particular position, let's talk about this. Like, these are our values. How can we align our mission, vision, values to the recruitment so that like when these candidates come here, it's not this awkward like, ooh, and by the way, can you like, we also don't want you to just focus on this. Like, there's going to be a lot of other expectations. And I think making that explicit is clear.
Yep. And Dr. Alvarez, I think that all comes back to you have to have the environment where those things can be discussed, right? So if it's uncomfortable and you've never discussed issues of diversity in your department before, then that conversation is never going to happen. So it's kind of you have to have all the pieces together. What other thoughts do people have? I think also we were going to transition to more discussion about microaggressions and upstanding. Dr. Alvarez, do you think we should make that transition?
Sure, we can do that. Or I think the conversation right now is actually going nicely. So I can just plant this the stem here, which is, what if you're asked? So again, this is a complete change from the topics that we've discussed. But what if you're asked by a patient that I don't want to see that doctor. He's Asian, and I don't want to get COVID. All right, that's clearly happened in the past year. How do you deal with that's by the way, to be clear, that is not microaggression, this is racism. And so we can like dial this down a little bit and use other examples, but the idea of having to make that choice, like, what would you say if you were the colleague?
So I would make an argument that this is actually something that needs to be dealt with at the institutional level before it gets to this point. I mean, I don't know how many institutions have that, but we have explicit policy basically saying, no, you don't get to do that. And we make it very clear. I mean, they actually gave us scripting text so that you're comfortable using it, basically saying something along the lines of, all of our physicians are excellent and we provide the best care, and Dr. So-and-so is your physician today. And, I mean, at some level, if they want to leave, they can leave. But that's their right. But we have scripted text just to make it easier on us, because in the middle of a shift, when I've got a trauma going on here and a code going on there, I'm not going to remember exactly how I want to do it. I'm not going to be the full mental state to be able to do that.
I love it. And I think that you brought up two great important points there. One of them is that it has to come from leadership. We have to establish this beforehand. We just expect that these things happen. And so why don't we just set the tone, like, we are not going to tolerate racism in this department. And so our department has said that like earlier on. And so when it happened, it was so like easier to say like, no, we're not going to tolerate this. We're going to medically screen you and we're going to discharge you. Or it sounds like you have an emergency, or I'm going to sedate you so that we can actually just take care of your medical emergency, right? The other thing that you mentioned is also very important, which is training. Again, goes back to the initial conversation here, which is very difficult initially. So having these challenging scenarios like discussed as your group as a whole will set you up for success, so that you're going to be a lot more equipped when you deal with it in the minute. As we're wrapping up, I think I just want to highlight what Dr. Haber also pointed out. Like, it's important to call it out and step up as an ally. Clearly, this is a big topic as well, allyship and being an upstander. And feel free to peruse many of the other talks that have happened in the past couple of days. And so I just want to end today's session with, again, efforts on advancing equity, diversity, and inclusion cannot simply just happen by people, by focusing on efforts by a few people. It has to be an entire departmental goal. It has to come from leadership. And we should start seeing diversity and representation as a vehicle to excellence, and rather than simply a token to increase some numbers or some metric that we go through. And again, thank you for indulging us with several of these scenarios. I think it's very helpful to hear from the different leaders here at SAM that this is something that you're passionate about. And feel free to reach out to us if you have any questions beyond today's talk.